Otomagnetics has developed an experimental platform technology that magnetically delivers therapy to the internal ear, eye, and skin infection targets. It accomplishes this by utilizing a minimally invasive magnetic injection platform to deliver therapeutic nanoparticles to better penetrate these organs. The nanoparticles are composed of biodegradable magnetic particles composed solely out of materials already approved by the FDA for injection into the body. The inner ear is difficult to treat because it is protected by the skull and by largely impermeable blood vessel walls. This limits the passage of most drugs from the blood into the cochlea. Even with transtympanic membrane injections, drug delivery depends on passive diffusion through the round window, leading to inefficient and limited drug delivery. Using Otomagnetics' delivery platform, a precisely shaped magnetic field delivers drug-eluting nanoparticles from the middle ear into the cochlea through the round window membrane efficiently and effectively. Once inside the cochlea, medication is released from the particles to treat hearing loss, tinnitus, or to protect hearing during chemotherapy regimens. The current treatment for middle ear infections is systemic antibiotics and/or tube insertion in chronic cases. Otomagnetic injection will enable non-invasive active delivery of therapy quickly to the middle ear compartment without surgery or eardrum puncture. Nanoparticles will be magnetically directed through the eardrum and efficiently reach the middle ear, where they then release antibiotic and/or anti-inflammatory drugs at therapeutic doses. With the promise of nanotherapeutics, Otomagnetics offers an advanced, minimally invasive, effective drug delivery system for multiple unmet clinical needs.